fear was historically a sign that danger was present. For some people, it can be, like I said, a really rough childhood. It can be growing up with very critical parents. Most self-sabotaging behaviors, such as perfectionism or procrastination or imposter syndrome, all that shit, is typically rooted in a fear.
Welcome to a new episode of the Engineered Mind podcast, where I am talking to researchers, scientists, and engineers and how their work is shaping the world around us. In this episode, Dr. Corey Wilks will teach you how to overcome your internal fears and start living the life you have always dreamt about. We cover the 4 horsemen of fear, how to tackle the illogical fear of becoming successful, why perfectionism is a myth and how you can overcome it, and so much more. To support the podcast, rate it on the favorite platform of your choice to make sure more inquisitive people around the world engineer their minds. Subscribe if you haven't already. And now, ladies and gentlemen, enjoy my podcast with Dr. Corey Wilks. All right, Corey, welcome to my show.
Thanks for having me.
Can you tell people what you're actually doing? Because today we'll not talk about engineering, but maybe how we can overcome our own fears, internal fears. Tell people, who are you and what are you doing?
Yeah, so my name is Dr. Corey Wilks. I'm a licensed clinical psychologist and executive coach, plus like writer, entrepreneur, whatever. I don't practice therapy anymore. I now coach business professionals, content creators, solopreneurs, those types. And then I create content around the psychology of human flourishing to help people kind of get more out of life.
Interesting. Could you explain what's the difference actually between a therapist and a coach? Where do you draw the line?
So primarily therapists deal with what's called psychopathology. So like mental illness is how most people describe it. So things like depression, anxiety, PTSD, addiction, that kind of thing. And I did that for a number of years. I mostly worked in like addiction medicine alongside physicians, that kind of thing. Whereas coaching, so the primary goal of therapy is to take somebody from dysfunctioning to functioning. Right, to just like get them to quote unquote normal function. Coaching is usually about taking somebody who's already relatively normal functioning and helping them thrive, flourish, optimize, whatever term you want to put on it. So coaching doesn't deal with things like depression, anxiety, that sort of thing, outside of like normal boundaries, right? So like normally people occasionally have, bad days, or they're a little down, or they're a little anxious, but it isn't to the degree that it's like clinically significant. So a lot of times with coaching, you're focusing much more on time management, thought partnering, helping somebody kind of get out of their own way. And a lot of coaching is focused toward either career transitions or expanding or improving their business, improving their habits, that sort of thing. So not like with therapy, which would be like, hey, how can we help you get out of bed? How can we help you stop self-harming or stop having panic attacks? That's usually the difference.
I see. You talked about normal versus being not normal. How do you identify if someone is normal? Let's put it that way.
So yeah, normal is a loaded term, right?
Yeah.
So when I say normal, I'm specifically talking about like you've seen like a bell curve, like a normal distribution of a bell curve. That's what I mean by normal. So it is normal, right? Meaning the majority of people would fall into like the big portion of a bell curve, right? Like that middle portion. Mm-hmm. That is what I'm calling normal. So when the majority of people occasionally experience anxiety, then that is a normal amount of anxiety, right? Versus what would be considered a clinically significant level of anxiety. Now you're pushing toward like the edges of that bell curve, right? Where it's like super, super close to the bottom. So very, very few people have that. So usually it's going to become, pathological when either the duration, the severity, or the frequency is beyond that normal part of that bell curve, right? So if you're getting anxious way more often, if it is way worse, things like that, then relative to what most people experience, then you're getting to the therapy realm.
I see. When we talk about anxiety, I think that's also very interesting for people listening to this podcast right now, especially engineers. I mean, when we are students, we sometimes have this anxiety, whether it's about an exam or maybe if you're an entrepreneur or solopreneur, hitting that publish button. I mean, you've just launched a course. Were you afraid of actually hitting publish? Is that something you're still dealing with? Although you know the effects, like the causality of what you're dealing with on a day-to-day basis?
Yeah, it's hitting publish, putting your work out there into the public is nerve wracking for anybody, I think. And now the more you do it and the more you get positive feedback, it gets easier. But every time you put out, you know, work, like that's a part of yourself you're sharing with the world, right? Like it feels really raw to do that. Um, so you're always going to have, again, a normal level of anxiety with that. The trick is learning to how can you push past that, right? Like it's okay to feel anxious. It's not okay to let anxiety stop you from doing meaningful work, right? So like, like for me, for example, I never feel like like I know what I'm doing. I never feel ready. I just don't let that feeling stop me from doing the work that I know I am well suited to do and that I know can benefit a lot of people. So I hit publish regardless of fear because I'm like, look, you know, when you're doing something that resonates with you, fear tends to pop up, right? When you're doing something you're not emotionally invested in, when you're just kind of clocking in, clocking out, fear usually doesn't crop up because fear only comes in when you're emotionally invested in the process or the outcome. So the fact that I'm experiencing a little bit of fear tells me typically that I'm on the right track. It tells me that the work I'm doing matters to me and is important to other people.
Yeah, that's super interesting. Do you differentiate between different types of fear?
Yeah. So when we're talking about fear, specifically around like limiting beliefs and things, the four most common fears or limiting beliefs are what I call the four horsemen of fear. And these are fear of failure, fear of ridicule, fear of uncertainty, and fear of success, right? So fear of failure is something everybody's probably super familiar with. Like you're afraid it won't work out.
Mhm.
But fear of ridicule, for example, that is when we're super wrapped up in a, well, how will other people react? What will my friends and family say if I do this, if I take this other job, or if I start this, side hustle, or if I hit publish on this article, what will other people think, right? We're so afraid of criticism and judgment. Fear of uncertainty is usually when we get so wrapped up in pre-optimizing or like over researching something because we're so afraid of making the wrong decision, right? Like, oh, should I go left or should I go right? I'm uncertain. I don't know. It isn't guaranteed. We waste a bunch of time trying to find the perfect plan or create the perfect, strategy, and we never actually make any progress, right? Because we're so afraid of making the wrong decision, we end up making no decision and taking no action, right? And then fear of success is really weird because on the surface, it's like, well, Corey, why would I be afraid to achieve the thing I claim to want? And for a lot of people, it comes down to a couple of things. One, some people believe that they don't deserve success, right? So like if deep down you believe you're a piece of shit and you're not good enough or, you're broken or something, then you probably believe you don't deserve success,
Mm.
right? And you will consciously or unconsciously self-sabotage to prevent yourself from achieving success because you believe you don't deserve it. Other people, success, major success, represents crossing this threshold into a different version of themselves. So if you've never achieved major success, however you define it, then success represents a before and after, right? Before success you and after success you. Well, if you've never achieved that success, the only version of yourself that you know, that you recognize, is pre-success, right? So I hear from entrepreneurs sometimes, they're like, look, I've been the underdog my entire life. What if I succeed and I lose my ambition? Or what if too much trust and authority is placed on my opinions? I don't, I'm afraid that I can't handle that level of power, and influence and responsibility. So they're afraid of essentially becoming corrupted, or they're afraid that they will lose all of their ambition, that they'll peak in life, right? And all of that is because they haven't achieved success, so they don't understand what success would bring to them and how they might change as a person. So those are usually the four most common limiting beliefs or fears I see hold people back.
That's super interesting. How do you usually, when you have a client or you work with someone one-on-one, how do you actually tackle that problem, like fear of success, for example?
So one thing I do, I call fear inoculation. And all it is say, is looking at what is the worst case scenario? What are you fundamentally afraid of happening? And let's assume that thing happens. With that assumption in place, what is your plan? Like, how will you do damage control? How will you recover from it? How will you buffer against the ill effects, right? So for example, with success, let's say you achieve major success and you start to lose your ambition. Well, how could you regain your ambition? Right. And usually at that point, a client is like, oh, well, I would try to surround myself with other highly successful people. And just being surrounded with that new social circle can help. But also I could reach out to other successful people and say, hey, how have you maintained or increased your ambition after this major success? Right. Because it's sort of like this analogy of, once you scale the first mountain, you realize you're at the beginning of the mountain range. Right. But if you've never scaled that first mountain, it seems like that mountain is the only mountain there is. Right. So it's like, well, damn, like after I scale this one, there's nothing beyond that. That's like the reality is most people you talk to who have achieved major success, after they achieve that first one, they're like, holy shit, I have way more potential than I had given myself permission to believe I had. Now that I've done this, I can do so much more. And I would have never recognized that had I not achieved this first major success, right? So surrounding themselves with other people, things like that, that's usually how the conversation goes. But it really comes down to whatever you're fundamentally afraid of, really looking at that. Because most of us, when we're afraid of something, we avoid it, right? So while I'm afraid of success, I'm going to avoid it. Well, instead, why don't you face that fear of success and figure out how would you survive or recover if your worst case scenario happened? Because fundamentally, we fear the unknown, right? Like, what happens if I fail? How will people react? What if I succeed? Like whatever. So by making the unknown known, or at least knowable through this fear inoculation, we rob fear of its power over us, because now we're like, oh, well, if shit hit the fan, if, my worst case scenario fear came true, I know how I would handle it. I would do X, Y, Z, whatever. So now that we feel prepared, we're not nearly as afraid. And because we're not afraid as much anymore, that fear isn't strong enough to hold us back from taking meaningful action forward.
That's so interesting. I feel when you talked about this uncertainty, I feel that's actually the marketing strategy. I'm not 100% sure of Uber. So basically, what's the difference between a taxi and an Uber? The difference actually is you have an app that tells you when the cab is arriving. That gives you certainty. And that's why actually Uber is so successful, because it gives the person certainty of when the vehicle is actually arriving. And for a taxi, you probably don't know it. But for an Uber, you probably know it very well, plus minus 1 minute, for example. That's pretty interesting. You also talked about
we pay a lot for peace of mind. Like the majority of the things that we pay for are convenience and peace of mind. So if you can offer your customers convenience and peace of mind, they'll probably pay a lot.
That's true. You also talk about this thing called perfectionism. Do you call it bullshit? Do you think perfectionism is sometimes laziness in disguise?
I think most self-sabotaging behaviors, such as perfectionism or procrastination or imposter syndrome, all that shit, is typically rooted in a fear. So with perfectionism, the way that most people describe perfectionism, yes, is bullshit. Because most people are like, oh, I'm just a perfectionist. Like, I just have a really high bar for quality. You don't. Everybody has a high bar for quality. The difference is you are using that as an excuse to never publish something, to never put your work out into the world. That's when it becomes bullshit, right? If you hit publish because you're like, okay, well, this is an MVP, let me just put it out there and then I will improve it. That's very different, right? True perfectionism isn't a high bar for quality or high expectations. It is, send me this way. Perfection is unrealistic. Like perfection in the real world is unattainable, right? Nothing is perfect. Everything is inherently flawed. It's just nature of existence. So if perfection is unattainable, perfectionism by definition is expecting yourself to attain the unattainable. That's why most people get fucked up with it, because you're literally expecting yourself to achieve something that you cannot achieve, right? And you tell yourself, well, until I achieve it, I can't put it out into the world. It isn't good enough. I can't hit publish. And it's like, okay, but you're guaranteeing you're never going to make progress, right? Because especially when it comes to like shipping something, the majority of the improvements are going to happen after you ship it, because that's when you start to get feedback, right? Mm-hmm. You can't just, incubate this thing in this perfect little idea lab and never put it into the world, because you never get feedback on it, right? So the majority of the time with these self-sabotaging behaviors like procrastination, perfectionism, whatever, these are rooted in a fear. So it isn't that you inherently struggle with perfectionism per se. It's you're actually afraid. You have this fear of ridicule, for example. You are afraid that if you put something out there, people are going to make fun of you. They're going to criticize you, judge you, whatever. So your perfectionism is allowing you to avoid facing that fear of ridicule, right? Because if you never hit publish, you never risk people judging the thing that you made. So perfectionism isn't your issue that you should work on. Your issue is you are afraid of other people's ridicule, judgment, criticism, whatever. So once you deal with that, right? So we go back to this fear inoculation thing. Once you deconstruct that fear and learn how you would recover from it if it happened, because you're no longer afraid of that thing, you no longer need to engage in this behavior of perfectionism, right? Because so there's this thing that psychologists call a functional analysis. Sounds fancy, really isn't. All it means is look at a behavior and say, what function does it serve? What purpose does it have, right? So for you, for maybe for you, perfectionism serves the function to help you avoid facing this fear of ridicule, right? So if you deconstruct that fear and it no longer has power over you, perfectionism no longer serves a function, because you no longer have the need, the desire to avoid that fear, because it is no longer powerful enough to stand in your way. Once you've overcome that, perfectionism tends to at least subside enough to no longer be stopping you, right? So anytime you're doing a behavior, right, like, I keep missing deadlines, or I keep taking on too much, it's too much on my plate, I'm spread too thin, or whatever it is, ask yourself, what function could this behavior be serving, right? And typically it is serving the function to help you avoid something else you're afraid of, right? So the majority of self-sabotaging behaviors come down to fear avoidance to some degree.
I see. I haven't read any studies on this, by the way, and you're the expert. Where is this rooted, this fear? Is it in our childhood where this starts to basically come up the first time? Is it childhood? Is it when we're 12 years old, 15 years old? Where do you see this behavior coming up first?
It depends on the person. So with the caveat, I'm not a developmental psychologist. So when it comes to and I'm not like a Freudian or psychodynamic, some shit with everything's rooted in your childhood. We all have fucked up childhoods to some degree, at least I do. So I'm not a big proponent of blaming your parents or blaming your childhood for things, although that can factor into it most definitely. Yeah. But if you're an adult, you're responsible for owning your shit, period, regardless of your fucked up childhood. But for some people, it can be, like I said, a really rough childhood. It can be growing up with very critical parents. So for example, I hear a lot from people whose parents are immigrants and things, regardless of what country they're from so far. Children of immigrant parents tend to, and again, I'm not quoting research, just my anecdotal experience, tend to really struggle with this fear of ridicule and this judgment because their parents were very critical of them growing up. Well-intentioned, right? They're, like the whole thing of like, you need to get straight A's, you go into like engineering or like one of these other three things that everything else is a failure, right? And that is really hard for somebody who wants to take an alternative path that isn't one of these, like the three, like, what is it like? You can be a lawyer, an engineer, or like a doctor and like few other things, right?
Or
like
failure.
those that, or a failure, right? Like take your fucking pick. Like which of these four do you want to be, right? And that's really hard when you're like, well, I love this, but I love this thing over here. Or yes, I'm an engineer, but I also want to try out, creating like my own, SaaS or something over here, right? It's like, well, now you're venturing into failure territory because, right, you're not exclusively doing this over here. So it's really hard. So when that is the case, learning to differentiate what thoughts are yours, like internally, like your own internal monologue, and what thoughts are actually your parents' words in your voice, or an ex's, or a shitty boss, or whoever, right? Because a lot of us, we internalize other people's voices, right? And the issue becomes when we forget that those words aren't our words. Because it isn't that I am telling myself I'm a failure. It's that my super well-intentioned but critical mother growing up would tell me if I don't do X, Y, or Z, I will be a failure, right? So it isn't that I'm telling myself I'm a failure or that I believe I'm a failure. It's that mom's voice is rattling around my head, or mom's words are rattling around in my head, and I'm mimicking her words so it sounds like me in my voice. So learning to differentiate your words from theirs is really important, because once you create the separation, you're like, oh, that's mom in my head. That isn't me. Those aren't my wants, my desires, my internal monologue, my personal narrative. It's somebody else's, right? I control the words that swim around in my head, right? So by learning to say, these are not my words, I don't want them in my head. It takes time, takes a lot of practice, but learning to differentiate yourself from the external voices you've internalized is super helpful for things like that.
That is interesting. I was wondering, I'm not sure how to formulate that question properly, but is it also that these fears are sometimes also a safety mechanism? Because it feels, when I go on TikTok, I sometimes see these cringy, shitty videos. People just upload them without thinking even about somebody might ridicule me, I could fail, things like that don't even appear to them in their minds. Do you feel that's also a safety mechanism, these four horsemen that you've described earlier on?
Yeah, so fear is adaptive, right? So, way back when we lived on the fucking plains and caves or some shit, think of it like from an evolutionary perspective. Fear was historically a sign that danger was present, right? So it makes sense from an evolutionary perspective that when we see like a bear, we experience fear and anxiety because that motivates us, that drives us to hide, to run away, to try in vain to fight the bear, whatever, right? So in that respect, fear is adaptive. The issue is, in modern day, fear is frequently maladaptive because physiologically we respond similarly to a bear, like being in our vicinity, that we do to a job interview, right? Of like, oh my God, like what if I bomb this job interview? And like you get fucking sweaty and nauseous, you have to pee, like also like those are physiologically, that's the same reaction you have to seeing a fucking bear in the wild, right? In modern day, most of us are rarely in danger, but we still experience fear. So learning to differentiate fear from danger is really important, right? Because a lot of times when you experience fear, you're not in danger. So for example, if you and I were in the same room and I held a gun to your head, you would likely experience fear, right? It seems like a normal reaction. But the reality is it's a Nerf gun. It isn't a real gun. You are in no danger, but you don't know that. So your whole experience is within your head because you're like, oh my God, I'm going to die. It's going to hurt. Da, da. But the reality is you're in no danger, right? The converse can also be true. You could be walking in the park and I could have a fucking sniper rifle on you. You would have no idea that I'm there. So you're in hella danger, but you would experience no fear, right? So learning to recognize fear and danger don't always go together. Frequently in modern times, we experience fear in the absence of danger, right? So anytime like you start to experience fear, one thing you can ask yourself is, okay, am I in danger, right? Like public speaking, you're not in danger. Job interview, you're not in danger. Hitting fucking publish on an article, you're not in danger, right? So at that point, your fear is often maladaptive because you're trying to kick into this survival response in a situation where your life isn't at risk. There's no need to kick into this because there's nothing to run away from or try to fight.
That makes a lot of sense, yeah. What would you say if I ask you if you are in fear sometimes? Like, do you feel fear when it comes to the entrepreneurial/solopreneur path? Like, why have you chosen not to do the classical, air quote, 9 to 5, but chose the coach path?
So another aspect of this is, like I said earlier, physiologically, right? Like fear has specific characteristics, but so does excitement. Physiologically, fear and excitement are very similar, right? So if I'm super excited about something, I may also feel the need to pee, and I may get sweaty, and I may, have butterflies in my stomach, whatever. So there's a specific theory that deals with this, but basically that's one way that you can like hack, quote unquote, fear is if you literally just tell yourself, I'm fucking excited. Your brain is like, oh, these physiological symptoms are due to excitement, not fear. Right? Like I don't get stage fright. I always have to pee right before I give a talk, right? Like whether it's like a literal stage or like a fucking Zoom call or whatever, literally and even like when I run like my live cohorts and shit, like for my courses or right before a coaching session, literally every time I have to pee. I had to pee right before this fucking interview today, right? I always have to. I always get like this physiological response. But I always tell myself I'm excited, right? If I told myself I am afraid, well, now I've labeled this physiological response as very negative, and then I start to spiral. But if I label it as I'm excited, well, now I've put a positive spin on the same neutral physiological symptoms. But because it has a positive spin, my brain doesn't spiral. It's like, oh, okay, cool. Like, let's fucking go. Like, this is going to be super cool, right? So that's like one weird little thing. You can just like literally just be like, I'm excited. Now it takes practice, where you can't just do that and then like it's fucking magic pill and everything's fixed. It takes practice, but you can do it. Okay. It's also why like it's one of the reasons why like scary movies are historically popular date nights, because you and your date are in the movie theater watching a scary movie, and then something scary happens on the screen, and they have this physiological response, and then like they grab you. And then the theory is that their brain is labeling this physiological response to proximity to you. So then they get like turned on and whatever, because like they're like, oh, this guy, this whatever, right? So like that is rooted in the same sort of theory. With that said, whether I label it excitement or not, daily I deal with uncertainty, right? Like entrepreneurship, solopreneurship is overwhelming, especially because like I grew up like poor as fuck. Like I grew up in like with America, I grew up like on food stamps, public housing, like Medicaid, which is free healthcare, which Americans don't get free healthcare unless you're super fucking poor. And I didn't have a business degree. I have no business background other than what I've like Frankenstein together the last 2 years I've been a solopreneur, right? I just kind of bumblefuck my way through, and sometimes shit works. But I've just learned to embrace that of like, look, this is part of the path that I've chosen, because for me, the tradition, like you said, traditional 9 to 5, I don't do well being told what to do. And with the therapy world, especially in America, There's a lot of red tape. There's a lot of bureaucracy that really gets in the way. Even something as simple as like in America, in order for me to do therapy with somebody, their insurance would only cover up until the point that they become what's called subclinical, meaning they no longer like that. You may still be kind of depressed, but because you no longer warrant the diagnosis of major depressive disorder, single episode mild, your insurance would drop you. They're like, hey, they're good enough. Fuck them. Unless you can afford that, unless you can afford to pay out of pocket, which where I was working was a very impoverished area. You have to quit therapy, which is super fucked up. Also just dealing with incompetent bosses and a bunch of other shit. So I was like, look, I know I have more value to give to the world through writing, through creating my own courses, through, helping people in a way that I am better suited to do without all of these typically cumbersome regulations. Now, regulations are important for therapy, right? Like I'm not saying like anybody just call themselves a therapist, but for me and with my training, there were better options, but those options came with the trade-off of all the uncertainty, all of the, you have to learn everything yourself. I don't have a guaranteed paycheck, but that guaranteed paycheck in my old job, as I'll speak to myself specifically, was really, really good at keeping you complacent because you made just enough to not do something else. Right. So it's really hard. It's really hard to say no to a guaranteed, on a per industry basis, high paycheck. Because I was like the third highest paid psychologist at my last job. That's really hard to walk away from. Thankfully, I got fired because of COVID shit. Because like I was fully remote and they were like, hey, like 2 months into my contract, they were like, my new contract, they were like, hey, we're pulling everybody who's remote. So you're fired, which is, it sucked in the moment, but it was fucking great long term. Because I was like, cool, I can't make excuses anymore. Like I have to figure this entrepreneurship shit out. So yeah.
When we go back to your childhood, Corey, I would be interested in, did you already know what you wanted to do when you were younger? Probably like a rhetorical question, but like, did you choose that path that you have chosen specifically because you wanted to have that introspection, if that's the correct word, pulling yourself out of that shit? You always had that inner voice that told you, you have to get out of that shit. You have to find a way to do that.
So, no I mean, when I was like a kid, I wanted to be like a zoologist or some shit or a marine biologist. Like, so I definitely didn't go that route. But my parents always told me, because like I'm from like rural Appalachia. So like near Huntington, West Virginia, which if you've ever seen or heard of the movie, like We Are Marshall, like that's where I went to school. It's around the area where I grew up. So there's a lot of blue collar work. There's a lot of, it's also where like part of like the opioid epidemic, like that was one of the areas really hit by all the opioid shit. Because a lot of people had very labor in like manual labor type jobs and they would get hurt. And then a lot of people got hooked on painkills and shit. So my family would always tell me, hey, use your brain, not your body. Like when you grow up, don't use your body for work because so many people in our area, like they break their bodies and then it's a huge issue later on. So whatever you do, whatever it's going to be, make sure it's your brain. So like I was a fucking weird kid. Like my mom still makes fun of me because like when I would like go to the bathroom, like I kept a dictionary in the bathroom and I would just fucking read the dictionary as a kid, just because. So I always relied on my intelligence growing up. I actually hated therapy as a kid because I was in therapy in and out. A lot of people who go into therapy, like a lot of like psychologists or counselors and shit, a lot of them initially do go into it because they're trying to fix themselves or work on their own shit. That wasn't what I did. I like, not only was I neutral, like I outright hated the therapy world early on because I had a lot of unhelpful therapists as a kid. But like all the stereotypes of therapy, like those were the fucking therapists I had. Like it was awful. So, but when I got to college, I was like undecided. Like I went from like business management to like dietetics, which is like food nutrition, to like all these other different things. And then one day I had this, it was a required like development course, like human development course. And the professor's like name was like, Dr. Hinton. I was like, okay. So it's a class of like 100 people. I'm expecting some like old ass white dude with fucking like elbow pads and shit to walk in. Like when he talks, like chalk just comes out of his fucking armpits or something. And in walked this young black dude from Memphis, covered in tattoos. He didn't look like a professor. He didn't talk like a professor. Like, he talked like he was from Memphis, and still does. His name's Dr. Keelan Hinton. Wonderful fucking guy. The passion he had for psychology and the way that he described it of, basically people are like puzzles. Psychology is learning how to help them put those pieces back in the order they need to be in. And literally from that first fucking class, after that class, I went and changed my major to psychology and then got a bachelor's, master's, and doctorate in it because of him primarily. Right. And I continue to tell him that to this day. But that was what psychology represented to me. Now, originally I had went into it to do therapy, but quickly I realized that therapy wasn't going to be a long-term career for me because I wanted to write. I love teaching. I taught in grad school, but I hated all the bureaucracy of academia and shit. So it's like, well, how can I just take everything I'm learning and then use it to do my own thing later on? Like, it was like psychology is a really good just foundation for a lot of other things.
Got it. Really cool. We talked about, I think we briefly mentioned depression. I was wondering what you think about the statement that one of the most Googled people on planet Earth recently made, or I think in one of his podcasts, Andrew Tate. Probably a ton of people know him. He says he believes in depression, but he doesn't feel that all of people are affected by depression because society tells you it's uncurable. You can't cure it. You need to go on medication and then your whole life is fucked up. Do you believe what he said? So basically the concept of depression is something society pushes on you. And do you think that you can heal it yourself with the power of the mind, however you want to call it?
So this is a very nuanced topic. I will oversimplify it because that's like a 15-hour discussion. But for some people, talk therapy, which is what therapy is, like anytime you go to a psychologist, counselor, social worker, whatever, that type of therapy is usually called talk therapy, right? Because they're not like manipulating your body. You're literally just talking to each other. Or psychotherapy is the formal term for it, as opposed to like physical therapy or something else, or occupational therapy. For some forms of depression, talk therapy is highly effective, like cognitive behavioral therapy to help you do cognitive restructuring, to approach how you think about things differently, to do behavioral activation, which is creating better habits, that kind of thing. CBT and other forms of evidence-based therapies are or can be highly effective. For other people, and you don't need medication for some, right? Like some, like straight up just regular fucking talk therapy works. For other people, you need talk therapy to learn skills of how to think differently, how to behave differently, whatever. But in addition to that, maybe your depression is severe enough that you do have a chemical imbalance that is resistant to being fully treated just through talk therapy. So you need that like biochemical nudge of a medication. So like the medication helps you get out of bed so that you can go to therapy, right? Now, yes, some people only take a pill and they never go to therapy, and that can be super problematic because you're treating a symptom and not the cause, right? So for most people, my recommendation is if you're going to do a medication, definitely go to therapy to supplement so that you can work on the skills you need to be autonomous. I know psychologists, like doctoral level psychologists, who are on medication, right? So just because like we know all these skills doesn't mean that we're perfect or immune to shit, right? Like, so the fact that I personally know people who are on medication, even though they're like a doctoral level psychologist, to me is indicative of some people legitimately do have a chemical imbalance that is very difficult to treat through just talk therapy. I'm also seeing some people more, and I haven't seen evidence, but like anecdotally, more and more people talking about like psilocybin and like other things like that, like for PTSD, depression, like, that kind of thing. There's a lot of promise in that. I'm definitely intrigued to learn more about it. But I've also, what you're saying, and I don't know much about Andrew Tate. I know he's like highly controversial, but part of it is, yes, some people sometimes are told that their depression, that's just how they are for forever. For some people that is true. For some people it isn't. Like that's the issue with all the psychology shit, man, is like every single person is fucking different. Like I know people who have been like super deeply depressed, like suicidal and shit. And then through talk therapy, they ended up coming out and quote unquote being completely fine. I know other people who have been in like good therapy for like a decade on medication. They've tried a bunch of shit and they're doing much better, but their baseline is way, way lower and way, way more depressed than a quote unquote normal, again, normal distribution, a normal person's baseline. Like some people just, whether that is because of trauma, because of like genetics, because of something else, some people, their baseline is just lower. The issue is that statement, the intention, I'm sure, is to empower people like, hey, take back control of yourself and don't accept a suboptimal existence. I fully resonate with the intention of that. The way that it is sometimes, that statements like that are sometimes perceived is similar to well, just pull yourself up by your bootstraps. Some motherfuckers don't have boots, right? To pull themselves up by their bootstraps, right? So like me, just because I grew up poor as fuck and was able to come out of it and get a doctorate and do a business and all sorts of shit, that doesn't mean I look at other people growing up on food stamps and be like, hey, motherfucker, like being poor is a choice. I've never met somebody who chose to be poor, right? I've never met somebody who chose to be depressed at the same time. So it is a very individual thing, but my advice to everybody always is go to therapy. Because the other issue with depression, specifically depression, is most of us, especially guys, we treat depression like a character flaw. Like, I'm not mentally strong enough, that's why I'm depressed. But here's the deal, motherfucker. If you have a cavity, what do? Do you talk to a friend? Do you blame yourself? Do you try to think through it? No. You go to somebody who specializes in treating cavities. Depression, anxiety, PTSD, all this other shit, addiction, same fucking thing. Sometimes you can maybe talk your way out of it. Highly unlikely. Your best bet is to go to somebody who specializes in treating the thing you're struggling with, right? Whether that is like Jocko Willink has called psychologists like mechanics for the mind, right? Like if your car breaks down, you go to a mechanic. If you have a cavity, you go to the dentist. If you have fucking depression or some shit, go to a goddamn therapist. Like, and if you don't find, and if the first one you go to you don't like, cool, go to another fucking one. It's the same shit with the mechanic or anybody else. Like keep going until you find somebody you click with and keep going, right? That's my take.
Yeah. How do you assess if someone is a good therapist? Because I feel, for example, if I had an issue, I would go to a therapist. It feels like when someone keeps repeating that I have negative experiences in my life and your life was shit and you can't change it, I probably should change my therapist. So how do you actually assess if someone is good and if someone is perfect for you?
So I usually tell people give it 2, maximum 3 sessions. And if you're not clicking with them, fucking move on. The most important aspect of therapy is rapport, which is just the relationship you have with your therapist, right? Largely, like, again, oversimplifying it, it doesn't really matter what the degree is. It doesn't really matter if they do CBT or psychodynamic or ACT or DBT, all these other fucking acronyms and initialisms of different types of therapy. All of those are largely irrelevant as long as your relationship with them is solid. Okay. Now, again, it's an oversimplification, but so like for me, for example, when I did therapy, I also used to have like long ass hair and shit. Like I looked like a biker. Like I'd come in like a fucking leather jacket, long hair. I still had this beard and shit. So a lot of the people that I worked with were people who had issues with authority. Cause like, I'm also like, I got tattoo sleeves and everything. So like I would have people literally Like I would be in one room, my supervisor would be in a different room. And like my supervisor's in like khakis and a polo and like all like fucking like well dressed and like well kempt. And then there's me in a leather jacket, or my jacket's hanging on the wall. And then like they see my tattoo sleeves, they see my fucking long hair and shit. And they're like, I want to go to you. Right. Because they're like, look, I've went to other therapists. I've been burned before because I don't want to just sit there and you ask me, oh, how does that make you feel? I don't want to do that. Right. I want, or they don't cuss, or they're not like blunt. Right. And that's specifically why, like, so some people, my demeanor would turn them off and they would want somebody else. Right. But other people specifically wanted me. And I was a guy in a predominantly, in a female dominated specialty in the area I worked in. Right. Like there weren't a lot of guys. So looking at what do you need out of a therapist, out of somebody that you like, what do you need to open up, right? Like what do you specifically need to feel comfortable talking to somebody else? Maybe that is simply like, well, I need a guy I need a woman to do like to be my therapist, right? I know some people who specifically don't want a guy, either because of trauma or because they just, they were raised by their mom. So they feel more open talking to women, for example, right? So cool. You have to figure out like, what are the bare minimums that you need out of somebody you're going to work with, and then search that type of person out, right? Honestly, man, finding a good therapist is super fucking hard. Part of the reason is because where are you at?
The Netherlands.
Okay. So yeah, so I cannot speak to how shit is over there. I hope it's better than it is here, because here with therapy, so like I coach people from all over the world. Like I'm in Kentucky right now, and I coach people from literally all over the world, countries everywhere. As a therapist, I'm licensed in the state of West Virginia. I can only see people remote or in person. I can only see people who are physically in West Virginia during the time of the call. So in America, that's the other issue with a lot of therapy is you are geographically restricted to the people you can reach out to get therapy, right? So you can only hit up people who are licensed in the state you're in, and you can only hit up people who accept the insurance you have unless you can pay out of pocket. So there are a lot of issues. A lot of therapists also have super shitty websites. So it's really hard to like gauge like who they are, like their personality and things. My advice usually when that is a situation when you don't really know, like obviously do a Google search, but beyond that, if you know anybody, like any friends or whoever who have been to therapy, see who they recommend. Because like if your friend approves them, then that's at least a good starting point for you to be like, okay, well, let me hit them up. Right. And your therapist, like they're not, well, at least in the US, they're not allowed to like talk to your friends about you and vice versa. Right. That is probably where I would start, is like literally just be like, hey, hey man, I know you've been in therapy before. Like, who'd you go to? Do you recommend them? Right. That's other than just doing a fucking Google search. Those are your two best bets. But yeah, give them 2 to 3 sessions max. And if you're not like clicking really well, move on. You don't owe them anything.
That's a good tip. How do I know if I need to go to therapy? I could tell myself all the time, no, I don't need it. I'm doing good myself. So I talk to myself. I'll talk myself out of it. I'm not depressed. I'm not a piece of shit. These kind of things. What would you recommend people to do? Are there like specific character traits where you would say, okay, now is the time to go to therapy, or how do you identify?
Not necessarily. So one way to think about it, if you are an introspective person and overall you know yourself, right? Because like, so with that assumption, some people like have no idea if they actually need therapy or not. But if you're pretty introspective and self-aware, one thing to consider is treating therapy like any other medical checkup, right? So with damn near everything else, you regularly, you go to the eye doctor, you go to the dentist, you go to your general, your physician, just for a checkup, just to be like, hey doc, just want to make sure everything's going all right. Right. Just making sure like my teeth are good, my eyes are good, or if they're starting to, decline a little bit, we catch it early, that kind of thing. Right. you can put therapy in that rotation of, hey, this is just to check in, just like a mental wellness check-in, just to make sure I'm not overlooking anything, right? So that way, one, if everything's going good, you got the stamp of approval, you're good to go, check in again in 6 months or a year, right? Like you would with a dentist or somebody. Or if something is maybe going on, because for example, maybe you're like, yeah, I'm not depressed. I've been way more irritable lately. I haven't been getting a lot of sleep. My appetite's been really fucked up. Like my energy's just, super low, da da da. Well, those actually could be symptoms of depression or of anxiety, or maybe just like shitty lifestyle choices, temporary, right? But maybe that's what you suss out in that checkup, right? So your therapist is like, well, actually, you may not be like classically depressed, like you may not be sad, but these symptoms can compound to turn into low mood. They can turn into anxiety, or maybe they actually are root anxiety because you have this specific stressful thing going on right now. How are you handling that stress? Oh, I'm not. I'm just bottling it up. Well, that could be problematic, right? Here are a couple coping mechanisms you could add in to your day that should help you reduce that stress so that your appetite comes back, you can get better sleep, right? Like your energy will improve, right? So treating it like a checkup and just putting it in like that rotation, that's one super simple way to approach it.
I have a couple more questions, then we'll wrap it up, Corey. I have a ton more questions, but we'll keep it at an hour. Maybe you'll have a second part in the future. How do you practice self-care for yourself? Do you just go to the gym? For example, if you feel maybe you have no energy, no motivation, you go to the gym, then everything is fine for you? Or how do you do it personally?
Personally, I lift weights. I do Brazilian Jiu-Jitsu, which is a martial art, kind of like wrestling for people who don't know. And those are really, really helpful because lifting. So I'm not a runner. I don't fucking run. But lifting to me, one, it's a way to build confidence if you need it. It's a way to see improvement, right? Which I think is super important to mediate against stress. You also control it, right? Like you control, like I'm a big fan of Stoicism. And one of the core tenets of Stoicism is learning to differentiate what is within your control versus what is outside your control, and focusing your time, energy, and attention on the few things that are within your control. So if I'm having a super stressful day or something that is outside of my control is happening, but that is mentally burdensome, I can choose to go to the gym. I can choose to work out. So I'm focusing on something that I do control, even though maybe the rest of my life is fucking chaos. So that gives me some semblance of control, right? So that can be super helpful there. Obviously, there are the physical benefits of it, because after you work out, you tend to get better sleep, you tend to have better energy overall, all that stuff, right? Better health. And then like with jiu-jitsu or some martial art or some social interaction, it gives me a lot of camaraderie. It's again, another skill that I'm improving in. It's a really good way to get out aggression. So those are the two things that I personally gravitate toward. Beyond that is going to be things like family time, reading, either fiction or nonfiction is good. I write a lot. That's both a professional and a personal thing that I do. That is the majority of my self-care, right? But I don't have a significant amount of stress, partially due to my expectations. I expect entrepreneurship to have a certain level of stress with it. So as long as the stress of entrepreneurship meets my expectations of it, it isn't really a negative. So I'm like, oh, it's supposed to be like this, right? Now, when reality exceeds my expectations of like, whoa, I wasn't mentally prepared for this level of stress, that's when I need to take a step back, be more intentional with self-care, that sort of a thing. But moderating your expectations is also a key component of knowing when to engage in self-care more deliberately.
If I would like to participate in your cohort or your courses, whatever you offer, Corey, how can I find these courses and what do we actually cover in those?
Yeah. So the best place to find everything is just my website, CoreyWilksSciD.com. I'm also Corey Wilks SciD across social media. I'm most active on Twitter, but I'm also on like LinkedIn and I think Instagram and shit. But the two courses I'm currently running. One is a live course, a cohort based course called Intentional Life Design, and that is currently it's a 5-week course, and we basically talk about how can you identify your core value and build a life aligned with what resonates with you. Right. So it's all about like flourishing, fulfillment type stuff. So basically just building a values aligned life and business. That's what that is. And from where it's live, you do it with a cohort of other people who are in a similar situation. We have a lot of like CEOs, entrepreneurs, content creators, students sometimes, that kind of thing. And then the course I'm currently working on, which will probably be live by the time this episode airs, is a self-paced course. And that is around becoming what I call a world-class coach. So like a lot of people have been asking me about like how to become a coach, or if they're already one, how to become a better one, or things like therapists trying to venture into coaching, CEOs or leaders wanting to incorporate coaching skills to be a more effective leader, that kind of thing. So I'm putting the best of everything I've learned over the last 15 years studying psychology into a self-paced course around how to learn how to be a world-class coach. And then like the other thing is like a lot of coaches, like the average hourly rate for a coach is like $500 an hour. So the course is like around about $200. So like you could literally sign one client for 1 hour and make double what you pay for the course. But that is also on my website. Like everything's just on my website. You'll find everything from there. But those are the two courses I currently have.
Really cool. If the phone now rings, young Corey picks up. With the knowledge that you have now, what would you tell young Corey? What should he do differently?
Nothing.
Why?
I am where I am because of what I went through. There are no shortcuts to getting where I have gotten myself. If I gave young Corey, if I gave young Corey advice to be like, hey, invest in Bitcoin and then sell in 2020 or some shit. But beyond that, it would just be, it would be not like one piece of advice would be, don't wait for other people's permission. Learn to give yourself permission to do the thing you want to do. That is the quickest way to success that I've found.
That's good. Do you believe in work-life balance, Corey?
No.
Why?
I believe in work-life integration. So work-life balance assumes I work over here in something I probably don't fully enjoy, and then I clock out and then I enjoy my life over here. That's fine. That works for some people. I personally am not a fan of what Tim Ferriss calls the slave, save, retire mindset of work a job for 40, 45 years you don't really care about, occasionally enjoy a week vacation here and there, enjoy yourself on the weekends, but then work those 40, 45 years, retire at 65, and then die at 80. I am unwilling to sacrifice 45 good years for the last 15 that I may or may not even make it to, right? Or the people I care about may not make it there with me. I am much more a fan of work-life integration of what the fuck gives me energy? What kind of work resonates with me? What is aligned with my values? And how can I make that financially viable? Right. So like I wrote for years before I hit publish. Now I get paid to write. I write like legitimately, man, like we went on like a vacation, not really a vacation, but we traveled for about a week and a half, about a month ago. And it was like painful for me to not write. Like I gravitate toward writing, and I still did, even though we were on like quote unquote vacation. Like that is what I would do regardless. So learning to identify what is the work that resonates with you and how can you integrate your work and your life so that everything you do is fulfilling, everything you do resonates with you and gives you energy. That to me is a much more viable and in line with human flourishing approach than work-life balance.
Do you interact with people who suck out your energy?
Not nearly as much as I used to.
That's good. That's a good answer. And then before I wrap it up, Corey, when will we see Corey making YouTube videos again? Because I think you made 3 YouTube videos and then stopped.
I've tried to get back a little bit. Yeah, it's one of those things been like, I love writing. I don't love making videos. However, after I finish this course, once it's live, I'll get back to YouTube because I need to. So yes,
promise?
Soon
Promise?
is the answer. Promise.
Who's your accountability buddy?
It's a good question. I don't know. all of Twitter is my accountability buddy.
You have to tweet.
Anybody who watches or listens to this podcast, hit me up if you don't find more YouTube videos.
That sounds
like harass me, like shame me into doing it. No, I will do it. I will do it just for you, if for nobody else.
One of the things I really appreciate about you, Corey, is that you just say things how they are, even with a lot of cursing in the podcast. So probably it won't be monetized, but whatever. We have the insights from Corey. So I really much appreciate you being on the show. Really much loved it, what you shared with us, and hope to see you in a second part in the future, Corey. Loved it.
I'd be happy to, man.
Take care.